Everyone. Continue my series of frequently asked questions for plastic surgery that patients send to me to answer. And the question today is regarded to a tummy tuck, and the question is, will a tummy tuck fix rectus diastesis? And the answer is yes. But let's talk about what rectus diastesis is. And what that is a separation of the rectus muscles, which is a six-pack of the abdomen, and that occurs with pregnancies. Why does it happen? Well, genetically, women are designed to a little bit more stretchy in the midline there to accommodate the growth of a baby. Some will stretch more than others. Why some don't, have diastesis, some don't, I don't know. But it's really just, one of those things of, I think is associated mostly with genetics, weight gain, the size of the baby, maybe some age in their component as well. But in the event that you do have some separation where you're trying to, suck it in and hold a flatter abdomen, and you can't quite get it as flat as you used to, typically have a little bit of component of that. And so a tummy tuck is one of those procedures that we can correct at the same time. So typically a tummy tuck is something that we elevate the skin off the abdominal wall, the muscle wall, and we usually elevate it up to the level of kind of where the chest, meets the abdomen. And then you can see the entire abdominal wall, and we can see the separation of the muscles. And so when we see that, we typically correct it, which is repairing or reconstructing it. So afterwards, the abdomen is flatter, is tighter, has more of a tone, and patients can have more of a flat toned abdomen after a tummy tuck. So great question. Thanks for following me this week. Stay tuned for next week.